Welcome, everyone. Hello, my name is Susan Sarah, and I'm the Executive Director with the American Diabetes Association here in New England. And it's November, and that means it's American Diabetes Month. We want to bring to you a very important topic this month, the importance of oral health and diabetes. I'm so happy that we have our guest today, Dr. Scialabba. Dr. Scialabba is the Chief Clinical Officer of 42 North Dental. He's also the Chairman of Massachusetts Board of Registration in Dentistry. Dr. Scialabba, welcome.
So Susan, thank you so much for having me here today. I'm so excited about the partnership between the American Diabetes Association and 42 North Dental.
We are too. And, thinking a lot about what we're going to talk about today, people just don't think about their dental health, as it relates to chronic conditions. So we're so pleased to announce that 42 North Dental and the American Diabetes Association is partnering to educate people on their oral health and how it relates to diabetes, also to educate and to get people to take our diabetes risk test. Our risk test is an easy 1-minute test. It's 7 questions. Someone takes it in less than a minute. They're going to have a response in their inbox. There's going to be suggestions on if they're on their health. And then it's also going to tell somebody if they're at a low, a medium, or high risk for diabetes. So it's a great partnership, Dr. Scialabba.
We have so many patients who don't even know they might even have diabetes. It's my understanding there's almost 8 million people across the US don't even know they have diabetes. It's just something that we know that we have to help educate our patients and get them healthy and get the best results possible.
Some people might be wondering, what is the connection between oral health and diabetes? Can you help people understand that?
The mouth is a gateway to the body. Today, more people lose their teeth because of periodontal disease than they do because of cavities. So when you're a diabetic, you're prone to having a dry mouth, because of medications you may be taking, and also because of reduction in saliva. You also, with the inflammation, are more prevalent to have bone loss around these teeth. So the combination of those two factors is really important to get under control. We're big on preventative care. We're big on diagnosis. So we don't want to have to treat somebody who's had this chronic disease prolonged, and their options are very limited once it's progressed to a point that's untreatable.
Should someone be scared to go back to the dentist after a while?
We already know about 50% of the population does not visit the dentist annually, and that's a combination of fear and cost. Add to that, we know about another 40% of people who have not gone to the dentist because of COVID. Dentistry is safe. We follow the CDC precautions of wearing N95s, wearing face shields, gowns. For those patients who are afraid to go and have not gone, we want it to be a welcoming environment. We want you to take care of yourself. So I think the days of being belittled and lectured to are the old way of doing dentistry. And then the new way is really what we believe in at 42 North. We believe in a multi-discipline, multi-doctor approach to providing you the best access to care, the best outcomes.
When you think about, talking to a doctor or talking to a dentist, sometimes that's hard to do. Many times people will just go sit in the chair and do whatever, Can you help someone, with a few tips on, how to talk to the dentist? Maybe if they haven't been there in a while, or just, for any health concerns you may have, can you give us some tips for somebody?
It's important to, number one, provide your health history. So many patients, don't necessarily hold things back on purpose, but they go through the process of filling out the paperwork and not thinking, should they just check the boxes? It's important to partner with your doctor, who has a direct line to when I say partner with your doctor, partner with your dentist, so that they can communicate to you and your primary care doctor about the best possible treatments or clearance if needed. We want to get you healthy. There's a big difference between having a controlled diabetic seeking dental care and someone who's uncontrolled. The treatment plans, the patients may present the same way, but the treatment plan or the solution might be completely different. You should communicate with your provider and let them know what's important to you. It's not about a transactional environment. We want it to be about relationship building. We want to bring a patient in and have that patient be a patient for life.
I really love that. And I think you're doing that with this partnership. I think together we can hopefully help people that you're serving who live with diabetes or are trying to prevent it feel like they're getting better education. The other thing is the risk test can also help with some of that relationship with the doctor. If you've not seen your
Absolutely.
dentist in a while, take the risk test. You can bring the result to your dentist to start a conversation. So we're so grateful to you in 42 North Dental Health for helping us want to get the information out to the people that you are seeing and to the people that we serve. So I want to thank you so much for your time today. We look forward to sharing this necessary education together, and we hope to bring you back and see each other real soon. Thanks so much.
Thanks, Susan. Really
Okay.
appreciate it.
Thank you. Take care.